Polycystic Ovary Syndrome, or PCOS, and Polycystic Ovarian Disease, or PCOD, are common hormonal disorders affecting women. They impact millions of women worldwide and can significantly impact a woman's life. These conditions can affect menstrual cycles, fertility, and overall well-being. PCOS and PCOD are often used interchangeably. However, there are subtle differences between them. Understanding these differences is crucial for proper diagnosis and treatment. It's also important to remember that every woman's experience with these conditions is unique. Symptoms can vary greatly from person to person. Some women may experience mild symptoms, while others may face more severe challenges. The good news is that with proper management, women with PCOS and PCOD can lead healthy and fulfilling lives. This video aims to provide a comprehensive overview of PCOS and PCOD. We will delve into the difference between the two, discuss common symptoms, and explore the causes and risk factors. We will also shed light on the diagnostic process and treatment options available. While the terms PCOS and PCOD are often used interchangeably, they are not the same thing. PCOD is a condition where the ovaries develop multiple small cysts. These cysts are actually follicles, small sacs filled with fluid that contain immature eggs. In PCOD, the ovaries may become enlarged and may not function properly, leading to irregular periods and difficulty getting pregnant. PCOS, on the other hand, is a more complex metabolic disorder. It encompasses PCOD, but also involves hormonal imbalances beyond just the ovaries. Women with PCOS have higher levels of androgens, often referred to as male hormones, although women produce them too. These hormonal imbalances can lead to a wider range of symptoms, including acne, excess hair growth, and weight gain. Essentially, PCOD can be considered a subset of PCOS. All women with PCOS have PCOD, but not all women with PCOD have PCOS. This distinction is important for understanding the full scope of these conditions and tailoring treatment plans effectively. The symptoms of PCOS and PCOD can vary greatly from one woman to another. This variability can make it challenging to diagnose and manage these conditions effectively. Some women may only experience a few mild symptoms, which might not significantly impact their daily lives, while others may have a range of more severe symptoms that impact their quality of life. These symptoms can be both physically and emotionally taxing, affecting various aspects of a woman's well-being. One of the most common symptoms is irregular periods. This can manifest in different ways, such as having periods that are too frequent, too infrequent, or unpredictable in their timing. Women with PCOS or PCOD may have infrequent periods, prolonged periods, or even skip periods altogether. This irregularity can be frustrating and concerning for many women, or even skip periods altogether. This inconsistency is often one of the first signs that something might be amiss with a woman's reproductive health. This lead to a prolonged and often emotional journey towards pregnancy, making it challenging for women to conceive. The uncertainty and repeated disappointments can take a toll on mental health, adding another layer of difficulty to the condition. This is a significant concern for many women with these conditions, as fertility is often a top priority. The desire to start a family can make the symptoms of PCOS and PCOD even more distressing, as fertility is often a top priority. Seeking medical advice early can help manage these symptoms and improve the chances of conception. In addition to irregular periods and fertility issues, other common symptoms include acne, which can be persistent and difficult to treat. Other common symptoms include acne, which can be persistent and difficult to treat. This can affect a woman's self-esteem and confidence. Excess hair growth, known as hirsutism, weight gain, which can be resistant to diet and exercise, and thinning hair on the scalp. These physical changes can be distressing and impact a woman's body image. These symptoms are often related to the elevated androgen levels characteristic of PCOS. Androgens are male hormones that are present in all women but are elevated in those with PCOS. Recognizing these symptoms early on is crucial for seeking timely medical advice and management. Early intervention can help manage symptoms, improve quality of life, and address any fertility concerns. Section 4. Causes and risk factors, unraveling the mystery. The exact causes of PCOS and PCOD are still not fully understood. These conditions are complex and multifaceted, making it challenging for researchers to pinpoint a single cause. However, ongoing studies continue to shed light on the various elements that may contribute to their development. Researchers believe that a combination of genetic and environmental factors plays a role. This means that both inherited traits and external influences such as lifestyle and diet can impact the likelihood of developing these conditions. Genetics certainly seems to play a part, as these conditions tend to run in families. If a mother or sister has PCOS or PCOD, the chances of another female family member developing it are higher. This familial pattern suggests a hereditary component that researchers are keen to understand better. Insulin resistance, a condition where the body's cells don't respond properly to insulin, is a significant factor in many cases of PCOS. Insulin is a hormone that regulates blood sugar levels, and when the body becomes resistant to it, the pancreas produces more insulin to compensate. This overproduction of insulin can lead to elevated insulin levels in the blood, which in turn can stimulate the ovaries to produce more androgens. Androgens are male hormones that, in excess, can cause symptoms such as irregular menstrual cycles, acne, and excessive hair growth. When the body becomes resistant to insulin, it produces more insulin to compensate, leading to elevated insulin levels in the blood. These high insulin levels can stimulate the ovaries to produce more androgens, contributing to the hormonal imbalances seen in PCOS. These high insulin levels can stimulate the ovaries to produce more androgens, contributing to the hormonal imbalances seen in PCOS. Additionally, lifestyle factors such as diet and physical activity can influence insulin sensitivity and overall hormonal balance. Inflammation, both chronic, low-grade inflammation and more acute inflammatory responses, has also been implicated in the development of PCOS. Chronic inflammation can lead to a range of health issues, including hormonal imbalances and metabolic disturbances. Risk factors for PCOS and PCOD include family history of these conditions, obesity, and a sedentary lifestyle. Maintaining a healthy weight and staying active can help manage symptoms and reduce the risk of developing these conditions. While the exact interplay of these factors is complex, understanding them can help women make informed choices about their health and potentially reduce their risk. By staying informed and proactive, women can take steps to manage their health and well-being effectively. Section 5. Diagnosing PCOS and PCOD. Diagnosing PCOS and PCOD typically involves a combination of medical history review, physical examination, and diagnostic tests. These steps are crucial in understanding the underlying causes and tailoring the right treatment plan for each individual. Your doctor will start by asking about your menstrual cycle, any symptoms you're experiencing, and your family history. This initial conversation helps in identifying patterns and potential genetic links that might be contributing to the condition. A physical exam will likely include checking for signs of excess hair growth, acne, and insulin resistance. These physical signs are often indicative of hormonal imbalances that are characteristic of PCOS and PCOD. Blood tests are usually ordered to measure hormone levels. These tests provide a detailed insight into the hormonal environment of the body, which is crucial for diagnosing these conditions. These tests may include checking levels of androgens, insulin, and other hormones related to ovulation. Elevated levels of androgens, for instance, can lead to symptoms like hirsutism and acne. An ultrasound may be performed to visualize the ovaries and check for the presence of cysts. This imaging test helps in assessing the size and structure of the ovaries, which is vital for a comprehensive diagnosis. The ultrasound uses sound waves to create images of the internal organs, providing valuable information about the ovaries' size and structure. This non-invasive procedure is a key component in the diagnostic process. It's important to note that there is no single test to diagnose PCOS or PCOD. The diagnosis is often a process of elimination, ruling out other potential causes of the symptoms. A diagnosis is usually made based on a combination of factors, and your doctor will consider all the available information to make an accurate diagnosis. This holistic approach ensures that all aspects of the condition are taken into account. Early diagnosis is essential for managing these conditions effectively and preventing long-term complications. With timely intervention, many of the symptoms can be managed and the risk of associated health issues can be significantly reduced. Lifestyle changes such as diet and exercise play a crucial role in managing PCOS and PCOD. Your doctor may recommend specific changes to help regulate your menstrual cycle and improve overall health. Support groups and counseling can also be beneficial. Sharing experiences with others who have similar conditions can provide emotional support and practical advice. In some cases, medication may be prescribed to manage symptoms. These can include hormonal treatments to regulate menstrual cycles or medications to manage insulin resistance. A personalized treatment plan tailored to your specific needs is essential for effectively managing PCOS and PCOD. Regular follow-ups with your healthcare provider will help in monitoring progress and making necessary adjustments.